The Psychedelic Report.
Psychedelic drugs
have played their part in America's long, strange trip toward an understanding of mind-altering drugs.
The Psychedelic News.
Leading physicians, scientists, and experts share their wisdom about psychedelic medicines and healing.
50 years ago, psychedelic drugs were at the center of America's counterculture.
The brightest minds in psychedelic medicine. The Psychedelic Report.
We use the ketamine-assisted psychotherapy model that happens to have psychedelic effects that were not predicted when the drug was first developed.
From researchers to investors.
I think the biggest mistake we've made as a culture is the war on drugs.
To physicians to shamans and nonprofit pioneers.
Psychedelic drugs.
Recent research suggests some of them could have legitimate uses.
The Psychedelic News
brings you diverse perspectives from the front lines of this exciting movement. The Psychedelic Report.
The Psychedelic Report was brought to you by Apollo Neuroscience and produced by Future Medicine Media. Welcome to the Psychedelic Report, your single source of truth for the psychedelic news. I'm your host, Dr. Dave Rabin. I'm a neuroscientist and psychiatrist trained in ketamine-assisted psychotherapy as well as MDMA-assisted therapy. Today, we continue to cover the breaking news around the upcoming vote for FDA clearance of MDMA-assisted therapy for PTSD. Up until this point, the clinical trials have demonstrated the results that are better than any medicine that has ever been approved to treat any mental illness in the history of psychiatry. And yet, we are still wrestling with the FDA Advisory Committee's vote, of which only one member had psychedelic experience, and very few had clinical expertise in PTSD, voted 10-1 that the benefits do not outweigh the risks of MDMA-assisted therapy for PTSD. The results of this vote were extremely surprising to clinicians and researchers in the psychedelic space and those who have been following the space for the last decade or more. Recently, it has come to the attention of this host and our guest today, psychologist Geoff Bathje, and Congressman Dan Crenshaw, that there were a lot of ulterior motivations behind the letters written to the FDA committee that informed their vote, which was supposed to be objective, and taking into account all of the evidence, including the results of the trials, which were clearly not taken into account in the report that they issued with their votes. And it has now become clear that because the people who wrote these letters publicly announced that they were attempting to sabotage the clearance of MDMA-assisted therapy by the FDA, that they're doing so because they don't like capitalism and they don't particularly like veterans, and that they appear to be protesting the trial with false claims of lack of safety and quality controls in the trial process. And we have been confused about why this is happening and what's happening for the last several weeks since June 4th and shortly thereafter, where one of the authors of one of these letters to the FDA Advisory Committee was openly published. So today we have as a special guest, Geoff Bathje, PhD, who's a former full professor and currently licensed psychologist focused on ketamine-assisted therapy, integration, and harm reduction in group and individual formats. He is also a policy advocate and community organizer working on issues of social justice, psychedelics, and ending the war on drugs. Geoff Bathje has written an article for Chacruna called The Unbelievable Claims of Psymposia about MAPS and MDMA-Assisted Therapy, which from my review, again, this article was published on July 19th of 2024. From my review, this is one of the most well-written and well-organized descriptions of what Psymposia as an organization is and the impact, the dramatic impact that they are having and taking pride in having on suppressing the MDMA from becoming a legal medicine for those in need. And that's been hard for us clinicians to understand. So Geoff Bathje, without further ado, thank you so much for writing this piece and publishing it. And thank you so much for taking the time to join me today.
Yeah, glad to be here. Could we start by just talking a little bit about what happened on June 4th that was so unexpected, and what we're seeing now kind of unfold as what might have motivated that unexpected vote?
Yeah, so you're talking about the FDA Advisory Committee's recommendation against approving MDMA.
Right. And that basically said, in so many words, that the risks of MDMA-assisted therapy outweigh the benefits, which basically says it's safer to live with PTSD than it is to experience MDMA-assisted therapy provided by a trained practitioner or practitioners, according to the MAPS protocol, which are big statements, right?
And that's a blanket statement, right? So it's saying not even, with the right screening, can we pick the people for whom it's safer? If you're saying no, it means no for everyone.
Right.
Exactly. Saying yes doesn't mean yes for everyone. It means yes for people who qualify into the treatment.
Exactly. So that vote was surprising in light of the wealth of evidence from clinical trials, of which many of them were very rigorous, but specifically the MAPS MDMA trials were double-blind, randomized, placebo-controlled trials. And, these are amongst the most rigorous trials that we conduct for getting new drugs approved. And they demonstrated tremendous effects, leaps and bounds better than any treatments that we use to treat patients that right now, especially patients of this severely afflicted PTSD population. And those results are published in Nature Medicine. So these are amazing findings for the field of psychiatry. So I think to a lot of us experts, as you mentioned in your article, the experts were petitioning for this to go through and be cleared, because the therapy has demonstrated with actual scientific studies, pretty tremendous findings. In a lot of ways, would you say, how would you rate the results in terms of the impact on the field to other things that we've been working with so far?
Yeah, so if you're looking at PTSD, the MDMA trials have the largest effect size, which is a statistic of impact of the treatment, based on the percentage of people who get a benefit above placebo. And so even though they had a very effective therapy, even in the placebo group, about 50% of people substantially improved. It was even much higher, I think about 70% in the medicine group. And so that was kind of showed that even the placebo group was on par with standard PTSD research. This wasn't, which I think partly also validates the MAPS therapy protocol that has come into question, is that the placebo group wouldn't have done as well as they do in any other trial if this was kind of bad treatment, as has been alleged. But yeah, the MDMA group, it kind of showed a clear addition to the therapy alone. And was the largest effect size, I believe, ever in a PTSD trial for either medication or a therapy.
That's my understanding as well, which is really exciting, considering that these patients don't have good effects.
Yeah.
In 30% success rates for the current SSRI treatments we use for these folks with PTSD. But to comment on what you were saying earlier, I think one of the things that's not understood commonly about this treatment is that the effect size is extremely strong for MDMA. The therapy also in and of itself works. Yep. But when you look at the results from the phase 2 trial at the 1 year out time point after treatment is stopped, roughly 50% of the placebo group relapses into symptomatic PTSD again, from my understanding, and more of the MDMA group are better. So the number goes up in the phase 2 from 55% in remission at the end of the study to 67% or something 1 year out, which we also don't see ever in mental health. Yeah. Right. Yeah. And that's probably less straightforward and less linear than it appears, I would bet, because trial participants I've talked to, it seems like they really, the MDMA experience provides a source of hope and maybe helps them make some progress that motivates them to keep working. And so I think a lot of them kept doing their therapy because now they saw a pathway. And so I don't know if it'll be as linear as there's this, kind of just ongoing growth that naturally happens, or if it's more like their MDMA assisted therapy experience encouraged them to keep working in therapy and keep working on themselves, basically. Yeah, it motivated them.
But either way, that's a great outcome as compared to backsliding.
Right. So all of this context, taken into account, we see the FDA Advisory Committee voting 10-1 that the benefits don't outweigh the risks for MDMA-assisted therapy, which, as you can see now as listening to this, is pretty surprising. So what is going on with this group that you talk about in your article Psymposia that is motivating them to write these letters to the FDA saying the opposite of what we see the science showing, right? To prevent, like, what is with the group that, my understanding, like as a psychiatrist and a therapist, part of me wants to understand, like, what's motivating a group that gets pleasure out of shutting down a therapy for these vulnerable populations in need?
Yeah, that's a fair question. Is kind of what is the motivation? What is the end game? Before I go to that, can I back up and just say a little bit more? Because you just said the AdCom committee decided that the risks are outweighing the benefits. And so there's two parts to that equation, risk and benefit, right? And so I think they've both questioned the benefits by undermining the data and to pointing out and highlighting potential limitations in the data, and have upplayed the risks. And that was part of my motivation for writing this. Was I'm also somebody who's passionate about drug policy and ending the drug war. And it's particularly the playing up of risks that greatly concerns me. You know, we're kind of just seeing some cracks in this drug war that's been going on for decades, and the upselling of risks for drugs that where we have a very good idea of the risk, because the only thing that could be researched for decades until very recently were the risks. We know the risks and harms of psychedelics much better than we do for any drug that FDA is ever going to review, just because there's been so much research on the risks. The benefits are the part where we needed the clinical trials more so, where that wasn't as well proven or established yet for MDMA. But hopefully I'm a researcher too, and I was on I was one of the researchers involved with the first ever meta-analysis of the clinical trials of psychedelics, and we included MDMA, but we also included any other clinical trial we could find: psilocybin, LSD, ayahuasca. And one of the really interesting things that came out of that, which I think speaks to maybe the legitimacy of the MDMA research, is that when you compared those trials of different drugs, all treating different conditions, the effect sizes were almost all identical. And so MDMA to treat PTSD, psilocybin to treat depression or smoking cessation, the effect sizes were all the same. And so it's kind of an FDA artifact that they require you to research a drug to treat a condition, one drug to treat one condition. And so I think we can walk away with the sense that these drugs are helpful only for specific things, when in fact they seem to be kind of equally impactful regardless of the drug and regardless of the different conditions that have been tested so far. And I found that to be probably the most interesting thing about doing that meta-analysis.
Yeah, that's fascinating. And to your point, and the safety point, it almost seems completely contradictory to even be focusing the conversation at this point in time on safety when, as you said, it's no secret that decades of research have gone into studying the safety profiles of these different psychedelic medicines, including MDMA. Yeah. Right. We know what doses are safe. We know what doses are not safe. We know how to dose it minimally to get the desired effect, and what the environment needs to be like in terms of, like, ideally as much safety as possible for the patient to have these very powerful transformative experiences. And there's a lot of, like, basics that we know. And you know, it's almost like this vote was the committee, the advisory committee, unfortunately, of which I'm told that the FDA takes their advice and follows them like 67% of the time, but which is why it's so important that, you know, we all understand that this committee's examination, criticizing the trials and not interpreting the data and really commenting on the benefits, was highly motivated by parties that were objecting to MAPS or the trials or the people who were being treated by the medicine that the trials were aimed at. And there was, or the combination of all of those things. And that this committee was supposed to be objective, right?
Yeah. And I've heard critique that, you know, maybe they were objective, but I've heard critique of the credentials to evaluate these particular studies, so that there was a lack of clinicians, lack of members who had expertise in PTSD, and very much a lack of expertise with psychedelics. And I think you could see that in some of their comments that, they were criticizing things that FDA had agreed with MAPS and Lykos about regarding the design of their clinical trials. And so, like, for example, saying that they maybe shouldn't have used an active placebo. Well, that was, an agreement that came out of discussion of the various options with FDA. And so they're also criticizing their own FDA, which kind of shows their probably lack of familiarity with this research and with the whole, kind of process of design and what the requirements and agreements were.
Yeah, these are many years ago conversations with the FDA, that many of which I think were started prior to 2010. So this has been going on for a good long time, long before Psymposia existed.
You're listening to the Psychedelic Report.
You also bring up a good policy point that I think is really underemphasized as well for all of those in favor of decriminalization. Legalization through the medical path, especially with like the 38 years of work that's already been done to move that along, is now singly the fastest way to legalization of MDMA, which is actually better than decriminalization. Because people, when MDMA is legal, licensed clinicians like you and me can use it and practice legally. But as a just decriminalized underground medicine, licensed clinicians are at risk of losing their license by practicing using a federally illegal substance.
Yeah.
So this FDA vote is critical for a number of reasons, but from the policy perspective, we're all on this. I mean, I think we're all on the same side of moving this forward, and it has to be the way to do it, to actually make it available to everyone and legal, fully legal, is to, and rescheduled is to move it through the FDA path, right?
Yeah, I view it as the medicalization as a step in that process of scaling back the drug war. So not only the harms of the drug war, but allowing the benefits of the medication, right? And so, it's not just that the drug war has been harmful and arresting people for basically consensual crimes, like they choose to put a drug in their body and are criminalized for that. But the other side of that is it prevents the any beneficial use of these drugs. And every class of drugs has medicinal use, whether it's stimulants or opiates or
cocaine,
depressants, or they all have, at least some drugs in those classes have medicinal uses, and psychedelics and cannabis no different, right? And so a lot of that potential beneficial use has been suppressed, and it's not just medical use, right? Like look at the huge impact that psychedelics had on the culture and music and art and the humanities. And so I don't want to limit it just to the medical use. And so I think decrim is still important for those other uses. Like probably an artist is not going to, especially if they don't meet criteria for a diagnosis, they won't be able to come into our office and get an MDMA treatment to help them, be more creative in their art. And right. I think that's valuable too. And so I do want to recognize that probably the medical use of psychedelics will always be a minority of the use that people will use for other, just recreational or personal purposes. So I think they're both important, decrim and the medical approval. But I don't think they have to be in contradiction. I think what Psymposia and members of Psymposia have suggested is that psychedelics are being ruined somehow by being used in ways that they don't agree with. And, I just fundamentally disagree with that. I think there are and will always be many possible uses of any of these classes of drugs. And as a harm reductionist, who am I to say that somebody can't make an informed decision about either getting a therapy or using them for some other purpose?
Isn't that like saying that we Psymposia have the right to decide who has access to healing?
Absolutely. Right. Yeah, I think so. And I don't think anybody, any small group of people should, whether with a lot of power or not, should be making that kind of blanket decision for all the possible ways that these things might be of value to different people.
Yeah, I mean, in medical school, we take the Hippocratic Oath, and a good part of the Hippocratic Oath is, and the practice and ethos of Hippocrates, is that every single human being has the right to heal. Mm-hmm. And we used to ask this question, and we used to be asked this question when we would interview for medical school, and I interviewed medical students coming in. That's like a joke question, but some people would get it wrong, and it was, imagine the person that you despise the most in your life. Or in history. And then imagine that person comes in on a gurney into the ER and they're mortally wounded and you're the attending on staff, do you take care of them? And if you say no, then you're out. You're out, bud. You don't get into medical school. Right. So like what I see that I see you drawing out in your article is that there is a group of very unhappy people who are upset with MAPS and upset with, I think you call out in large part something that's very interesting, which is they're upset with the transition of MAPS as a completely donation-funded nonprofit into a pharmaceutical company, which is required to disseminate the healing, the medicine, the modality once it's actually, produced, et cetera. And, and as you said, like, this is one of Rick Doblin's like greatest disappointments, that he couldn't do it with only donations. And that would have been great, but that's just not reality for the field. So to hold that against them to the point where they make false claims to shut down and overstatements to shut down and squash a new treatment, which to me, my mind is like unprecedented. I've heard of people protesting for new treatments for underrepresented conditions, but I have not heard of people protesting against treatments for vulnerable populations. That is a new one for me. And that this radical hatred for MAPS as a result of the decisions that they made to endorse Compass and become more of a for-profit capitalist-based company that's capable of raising the funding needed to get this over the line upset them so much that they think they have the right to decide, as not clinicians, as not healers, as not people who work with patients, who has the right to access this tool, right? This is like quite unprecedented.
Yeah, and right, and I agree. I don't think anybody has a right to say that. I think if the data truly point us in the direction of a treatment being ineffective, then great, let's not approve it as a treatment. I'm all on board with that. I don't believe that's the case with the data. A lot has been made of things like functional unblinding, which probably almost nobody has heard of until now. Until now, yeah. Yeah, in which FDA doesn't require even to be measured. So, but where it has been measured is we know that functional unblinding is probably there for most drugs, and is maybe just as powerful as for psychedelics for some drugs. So particularly psychiatric drugs, there's quite a strong, because of the side effects of them, right? They might not be psychedelic effects, but people get side effects and they're taking them over weeks or months as part of a clinical trial. And so they can tell in the few studies that ask people if they can tell, if they thought they were in the placebo or the medicine group, large percentage of them can tell they were in the medicine group. So functional unblinding is like one of those open secrets that we know is a problem to the myth of the randomized controlled double-blinded clinical trial. That maybe it's not so blinded, but there's this like holding of psychedelics, for everything, right?
Every randomized double controlled trial. That's the single flaw, is that people might guess which group they're in, and the researcher might guess which group they're in.
So the more side effects the medicine causes, the more that is in place. And so there's this holding of psychedelics to a different standard than any other drug would be held to in terms of the things that are being critiqued, right? So the things that they're critiquing are FDA limitations. They're not limitations of the psychedelic trials.
But it wouldn't take more than a couple hours of some PubMed and CBI research to understand that of all the trials, and I'm sure maybe you covered this in your meta-analysis, I can't remember, but that of all the trials looking at the side effect profiles of the SSRIs that we're using today on patients, compared to the side effect profile of 3 doses of MDMA, MDMA is way safer and has way less side effects, and very few, if any, long-lasting side effects compared to what most people end up reporting from long-term use of SSRIs, right?
Yeah, which is probably, intuitively makes sense for a drug that you would take every day indefinitely versus one you take maybe a few times, or even if you do it a lot more than the 3 in the protocol, you're spreading them out. They're not you're not taking it on 30 straight days or something.
Right.
Yeah, it's in a therapy protocol, and so there's lots of time for processing that doesn't just require going back to another administration of the drug right away. And I'm a ketamine assisted therapy provider, and I help people with psychedelic integration, and so when I hear the trial participants talk, it's familiar to me, right? Like the ways it can be helpful and augment therapy, and how people often miss those benefits without the therapy. And I do think that a lot of the arguments from this group would point in the direction of minimizing the role of therapists, which I think would be a big mistake, which I think would reduce the effectiveness. But the other clinical trials are already, based on this decision kind of playing up that, that therapy is less central to their models.
Yeah, I think that's an important concern. And, and the importance of the therapy can't be overstated, right? Like this, when you actually ask people, especially, I'm also a trained ketamine assisted therapist and trainer. And I also do, I'm trained in MAPS approach to MDMA assisted therapy to do mechanistic research on MDMA. And one of the things that is so clear is just the importance of the safety that is provided to the patient with the therapy experience, and that because the safety helps them feel safe enough. PTSD is a disorder of learned fear. We know this from animal studies and from human studies. It's a learned fear disorder. How do you fix learned fear? You relearn safety. MDMA accelerates the relearning of
and it's
safety.
largely interpersonal fear, right? Yep.
Exactly.
Unless it's like a car accident or natural disaster or something but even those often had like an interpersonal component, like, even just wanting somebody to come help you very quickly makes it interpersonal.
Right. And fear of yourself too, for not doing things right, or, having regrets in your life, or, survivor guilt or whatever it is. There's so many things. But the point is that the entire therapy approach without MDMA, just the basics of regular psychotherapy and clinical care is all rooted in the patients feeling safe with us, the clinicians. MDMA added on to that is only focused on amplifying that safety and the benefits of that safety so that people feel safe enough to remake meaning around the past traumatic events.
Yeah.
So to spend all this time critiquing the safety of something that could be assessed in a 2-hour Google PubMed NCBI Google Scholar search is pretty astounding to people like us, who are like both clinical providers and researchers and, study this stuff. Like it just seems so, out there and out of context.
And that's one of the pieces that they've critiqued, right? Is that because people are more open and trusting on MDMA, that would invite, unethical practitioners to take advantage and abuse people. And, if that's going to be the rationale, we shouldn't have anesthetics because you're completely unconscious. Somebody could do whatever the hell they wanted to do, right? So
and they have. There have been abuses across all fields of medicine.
Yeah.
Unfortunately.
And that's why we have, a strong emphasis on ethics and training, and why we have licenses and why we have boards that review that. And they're actually pretty good at the professions are actually pretty good at policing themselves.
Those medical boards are a pain in the ass.
It's not in anybody's interest to have people doing unethical things in the field. And I think you saw that with the one case in the MAPS trials at the Canadian site where a sexual boundary crossing happened between a clinician and a trial participant after the trial had ended. That was a husband-wife team where only one of them was licensed. The one who did not have the sexual experience with the client, who knew about it and didn't report it, lost her license. So she was less implicated than her husband, but still lost her license. So it does show that the professions, it's in nobody's interest for the professions to have people like that practicing. It would just kind of erode any ability to have faith or trust in clinicians. And so there's pretty zero tolerance for that kind of thing.
Yeah, absolutely zero tolerance. And from my understanding, that is the only incident, right, that happened in the trial, and it was reported.
Of that sort of like a sex between a therapist and a client. And
the boundary crossing during the trial experience likely. And that data, from my understanding, was also excluded from the analysis because of that.
Yeah.
You're listening to the Psychedelic Report.
What I would love to talk to you about is this group that is somehow motivated to get pleasure out of squashing this incredible discovery that, from our conversation and from the conversations we have been having, clearly has a positive benefit for society at large and for extremely vulnerable patient populations. What's going on here?
Yeah, let's talk about that. So, and I will note that one piece of feedback I got, which is I think kind of valid, is that sometimes it's hard to know when Psymposia is acting as an organization versus the individuals, and I think sometimes they've used that to their advantage, where like something will be posted under the Psymposia account, all the Psymposia members will repost it. And then when they're questioned about it, they'll say, like, I didn't say that, Psymposia said that, or vice versa. So I have seen some kind of gaming of like what's Psymposia and what's the individual. And so people have pointed out to me, though, that Psymposia hasn't published or produced much in the past year. And people are more often citing some of their academic credentials instead of Psymposia. So I just want to note that I, intentionally for shorthand kind of reference them as Psymposia. They're still on the website minus David Nichols, which isn't his real name, I'm learning, by the way. I don't know if you're aware of that, but
I think he chose that name because he wanted to be confused with the actual David Nichols, who's a psychedelic pioneer, right?
Yeah, that's what I was told.
I don't know if that's true either. So I
don't know about that latter part, but I've had 10 people tell me that's not his full name. But
that's really interesting.
Which, as a journalist, I think you got to question kind of the integrity there if you're not willing to put your ideas and your critiques under your own identity, and particularly if you're trying to have those be confused with somebody else, that's questionable. Yeah.
Well, so to jump right into what I really want to know is if we're going to talk about the individuals also reference in their writing that they are part of an organization called Psymposia.
And they're still on the website.
Right? So the one thing that I am most interested in learning about from you is the open letter to the FDA Advisory Committee that was written and then publicly displayed by, I don't know how to say her name exactly, but Neshe Devanot.
Yeah, I
right?
think it's Neshe Devanot.
Neshe Devanot. So she wrote this letter to the FDA that she then published, talking about all of the things that we just mentioned in terms of these criticisms of the MAPS trials that, as scientists and researchers, are really off base and unfounded. She wrote this letter falsely representing what's happening and falsely representing information to the committee, and then the committee voted from what it appears to be with a focus on the things that she brought up. Rather than looking at the results.
And the ICER report, which also, FDA AdCom was obviously familiar with, pretty much the only sources, if you look at their sources where they wrote on the risk and harm, were Psymposia sources.
Right, that was my understanding as well.
And they're footnoted as having talked to a few of them as well. So they've had kind of like an outsized impact in kind of highlighting the risk through ICER, and then also directly, but also indirectly through ICER to the FDA's committee.
And so, I think what has a lot of people wondering, myself included, is, Ms. Devanot ended up down shortly thereafter the June 4th vote, went on social media and tweeted that she was proud of what she had done to suppress, effectively bias what was supposed to be an objective FDA Advisory Committee review, and really do her very best to squash the MDMA-assisted therapy trials.
She documented it pretty thoroughly, and then I linked to that in my article too. So
right, and you mentioned this. So what is motivating her? If we're just going to talk about her, maybe it's the same thing that's motivating all these folks, but what's motivating her in doing this?
I don't totally know, and the only things that I can point to that I know that they've said is that they've had a lot of kind of anti-capitalist, anti-corporate writing. MAPS and Lykos are probably the least corporate drug developers in all the pharmaceutical industry, other than USONA, the other nonprofit that's been working on psilocybin. But so I have to assume it's more about MAPS being and MDMA being the gateway drug to other drug approvals. And so I wonder if MDMA was first, if they would have gotten this much attention, or if it's primarily because it's the first one. And then, which fair enough, I have a lot of those, kind of critiques of capitalism and the kind of disease-focused Western medical model and the corporatization of medicine, and I don't like any of those things either. But the idea that you can't have your treatment until we expel capitalism and corporations from the medical system, that's not happening anytime soon. You might as well tell somebody they can't eat food until they get it outside of the the corporate capitalist system. It's just not reasonable.
So
and again, this is like putting this responsibility on psychedelics. That's like a broader, cultural and societal issue.
Right. Yes, I agree. And they're not connected in that way, right? Mm-hmm. Like we're really talking about multiple separate things up on which probably many people at MAPS would agree with them on. Mm-hmm. At the same time, should not be tied to the limiting or suppression of a treatment getting to people who need it, right? I mean, like this is really potentially extremely damaging for the entire field of psychedelic research. I know, investments in the psychedelic space tanked significantly when this June 4th vote came out. So, industries need money to be able to come up with treatments and cures and all of these things, just like every medical industry has had. We need it needs funding to be able to do these things. And so, this has a tremendous impact. And with that, the vote of the actual FDA committee members will be coming up very, very soon. And then August 11th is when they have said it will be. And what I'm looking for, given the challenges that we're facing in this situation, particularly as a medical community, let alone being a patient struggling, is that there's a huge education gap here. And that the FDA now has biased information that is going to be steering them probably with a fairly significant angle towards
even if they can sift through that information, there's the whole political angle of they might not have the appetite to reschedule a Schedule 1 drug. It'd probably be different if this was some drug that was non-psychedelic, not related to any scheduled drug. It was the same situation. I think like for example, FDA just recently ignored, I think it was a unanimous vote from their advisory committee for an Alzheimer's drug maybe a year or two ago. And so they do, and they will ignore their advisory committee if they think they get it wrong. But I don't know if they'll do that when it's a Schedule 1 drug that has more, doesn't have the same cover as opening up a treatment for Alzheimer's. It's not a controversial substance otherwise.
Yeah, that makes sense. And I guess one of the questions that I had for you is, given that the advisory committee is so influential, the two things that seem to need to happen from the science community, the medical community, the patients, because I'm a solutions focused guy. So I'm always like, okay, what do we do now that we know that things are the way they are? And the two things that come to mind of what we need to do as a community that I would love to get your opinions on are, number one, we have to help make sure the FDA understands that the vote on the opinions of the FDA Advisory Committee were influenced by effectively what you're describing as a radical anti-capitalist group.
Which those perspectives were completely absent from their comments, right? They know their audience. So those were not part of their arguments. Their arguments were about, the trial data, and then this bizarre claim of MAPS being a cult, blending MAPS and Lykos too, which Lykos is now its own organization and is responsible for the trials, where MAPS was responsible for some of the earlier trials. Yeah, it's like all these things outside the trials that don't have to do with the safety or the benefit of the medication, by people who are not clinicians, not therapists. So nobody that I name in the article has direct expertise in like how a therapy should be conducted or how a clinical trial should be designed. And I think that's an important issue as well.
Yeah, absolutely. And the FDA that will be voting on August 11th will hopefully be aware of the history that MAPS has had with them, but they will also have and what was agreed to between MAPS and the FDA. They'll also have this incoming information from the advisory committee questioning the ethics, validity, et cetera, of the clinical trials, and basically stating we're not sure the results can even be interpreted, even though this has already been done. Like, we've been through this. So that seems kind of off base. And then, what can we do basically, right? Because to me, the only thing that we can do is demand that the FDA do a full review that actually of their own, rather than just taking the opinion of the advisory committee. They actually do their own independent review. And if it takes longer than August 11th, it takes till September, that's fine. But like actually look at the data, actually do the review for yourself and understand, do the benefits truly not outweigh the risks for the use of this medicine? Because, from what we can tell as scientists and researchers who are experts trained to understand and interpret this data, it does. It does. Yeah. Benefits outweigh the risks dramatically. Yeah. So can we do that? Like, can we, do we write to the FDA? I
think some groups have done that. Some groups of experts have written to the FDA and made public statements. And so I think that's out there. I think, that's part of what motivated me to speak up was that I have clients who want this treatment available, who have tried everything else, who, including some who, not just clients, but other people. I'm an organizer within the psychedelic community doing harm reduction work. But so I've met people in various settings who, were very distressed by that vote, up to the point of even becoming suicidal because of that vote. And so not because of hype, not because they've been sold on some hype that MDMA is a magic bullet, but because they've tried every other treatment and medication and none of them have helped them very much. And so I think that's an important distinction too, is like people are not just supporters of MDMA for hype reasons. It's often because they have exhausted their other options. Maybe they've had experience with psychedelics where they got a glimpse of the potential, but they want it in a better facilitated, more structured therapeutic setting, not just kind of DIY.
Yeah.
And so I don't know what we can do other than kind of speaking out and I'm sure FDA reads the news as well as we do. Their people in those boards and committees. And so, I think if they truly just look at the data, there's enough there to approve MDMA based on what was submitted. And like you, if they feel like they're not there, probably for political reasons, because of the optics of it, that I hope they'll, instead of issuing a no, that they'll issue an extension and go talk to some of the trial participants, because I've talked to some of the trial participants. Some of them have reached out to me in the past week and a half since I published that article, or almost 2 weeks now since I published that article. And what I'm hearing is that probably some of their experiences have been misrepresented. So I talked to people who did have suicidal ideation in the time period after the trial, but they didn't attribute it to MDMA or to the trial. They attributed it to other things that were going on in their lives that were challenging, and some of them have talked about like being negatively impacted by the reporting too. So questioning, like, Psymposia did a good job for a while, and Power Trip podcast did a good job for a while there, kind of dominating the narrative, and people were kind of intimidating people into not challenging them. And so I think that caused some people who'd gone through the trials to kind of question, like, why isn't somebody countering this narrative? And so I think all that kind of muddies the water. And kind of going back and looking at a review, I still think the best data is going to be the data that came out of the clinical trial. But if the next best thing would be to kind of go back and talk to some trial participants. There are serious limitations of like asking people to retrospectively rate an experience. I know this from conducting studies like that. There's something called the halo effect, which is that if you feel good about the experience, then you're likely to kind of evaluate all aspects of the experience as good. If you feel bad about it, which and I do think the negative reporting probably skewed some people toward feeling bad about it, who might have felt better about it previously. Then the halo can be negative. Like, you can kind of view multiple aspects of it as negative, not kind of a little bit more globalized when you look back in hindsight.
Right. Exactly. I mean, we're scientists, and we're not talking about N of 1. How did you personally feel? We're talking about everyone in the study, and what did their objective, or as objective as possible, outcomes look like? Because we're doing real science. This is not messing around. So, I think also it can be re-traumatizing for subjects to have to talk to the FDA, especially if it's not consensual around their experiences, right? Some people might not want to talk about their experiences at all, or might just want to see it as something that's in the past. A lot of people I do ketamine therapy with, they see these experiences as a save point in their life that they don't want to go back to, because there was so much reprocessing of traumatic material that they're like, okay, I had that, I did it, it's great, I'm good from here on out, and I'm working on myself now. I'm like motivated to do the healing work. I'm, for myself. And I think that's what we're seeing with MDMA-assisted therapy. And, that's why this research is so exciting, and that it must continue, and that we must provide these tools for patients in any way we can. So, if you're listening to this, thank you, Geoff Bathje, Bathje. Check him out and his article on in Chacruna about the MAPS trials, the MDMA trials, and the undue influence of Psymposia. Reach out to us. We'd love to hear your thoughts. And I just want to thank you again so much for taking the time to join me today.
Thank you for having me. Take care.
Thanks for listening to The Psychedelic Report. Visit us at thepsychedelicreport.com. This show is recorded weekly on Clubhouse with a live audience. The Psychedelic Report was brought to you by Apollo Neuroscience and produced by Future Medicine Media. While I am a doctor, I'm not your doctor. So please don't take anything you hear on the Psychedelic Report as personal medical advice, because we don't know you. If you have questions about anything you hear on this show, please consult with your doctor.